What are your best practices for communication between PT, OT, and SLP colleagues who are all treating the same person with Parkinson's disease?
So within our clinic, I think the best way to communicate is, just really to communicate openly with the other clinicians and collaborate as best possible. Sometimes it might be as I'm ending a session, I might, perhaps the person has to go to the restroom. And so I might run over and talk to Meredith for a few minutes if she's got a second and kind of brief her on what was going on. We use intra-office messaging sometimes too, and we'll send a little message if there's anything really imperative that the person needs to know maybe before their session that day. Sometimes we'll brief in the morning as well before we start treating. So, you saw Mr. Jones yesterday. How did it go? What did you add that was new? And then also we're always reviewing each other's documentation to see what was added in and what was added, from a new perspective. We'll email if we have to. Sometimes conversations happen in the lunchroom. So I think that we, get the communication in however we can. And then sometimes even I know in the moment, I might be doing big with someone and Heather will run over and, oh, Jewel, I forgot to tell you, we added in this yesterday, or we added in, cognitive dual tasking. So I think that it's just keeping that open, dynamic communication as best you can, however you communicate with each other currently.
Well, I agree with Julia. I think it depends on what setting you're in, what the best way to communicate is. So it can be informal communication, which could be sort of an informal huddle, or touching base with someone in between sessions, or grabbing someone on a quick break. It could be something a little bit more formal, where I'm sending an email or I'm sending a message on someone's medical record and reaching out to someone that way. It could be an instant message on the computer. It could be a drop-in on a session, or if you have back-to-back sessions, then you can walk somebody over to their next session and do a quick huddle at that point, or do huddle in front of the patient and say, hey, Mr. Smith, how do you think you did today with your voice? How do you think you did with your movement? And then we can kind of talk about it together, including the person with Parkinson's in the team as well.
So my other two team members have talked to you about, a great opportunity to communicate. And not all people are as lucky as we are to be in the same place. So oftentimes we will have clinicians ask us, I am the physical therapist and I'm at this site, but our facility doesn't offer the LSVT loud. So I had to send my client elsewhere to a different therapy place. And it might not even be in the same health system. And in that kind of situation, which is absolutely not unheard of, it's going to be even more important that you stay regularly in touch with each other. And that may come in the form of phone calls, that may come in the form of emails. You want to make sure that your patients have signed off on all communication, that they're giving you the ability and the permission to share that information. Because again, you as the PT or the OT want to know what those functional phrases are. What is that patient hoping to accomplish? Is it communication outside of their home? Is it that they are a professor and they need to be able to give lectures in front of people? What are the things that speech language pathologist is working toward? And equally, we want to share our information as the clinicians providing LSVT big. And I can say to that speech language pathologist, he's going to have a really hard time when he first comes through the doorway, because he's somebody who freezes a lot. So if you can use, this is the cue that I've been using with him, or when he goes to sit down in his chair, he often just plops in the chair. He's not controlling himself with that descent. So here's what we've been doing. So I really like to, when I'm working with people who are outside of my system, give them very practical information. So actual descriptions of what that patient is struggling with. And then that way you can really open that door of communication. So again, even if you're not together, you're still working on those same goals.